Why does medical brain drain cause global health disparities? Have you ever wondered how the movement of healthcare professionals affects health systems around the world? Medical brain drain is a term that describes the migration of trained healthcare workers from low and middle-income countries to high-income countries. This trend has significant consequences for global health disparities. Let's break down why this happens and how it impacts healthcare access. When skilled doctors, nurses, and midwives leave their home countries, they take with them critical knowledge and expertise. Low and middle-income countries often struggle with limited healthcare resources. The departure of these professionals worsens the situation, leading to fewer healthcare workers available to care for the population. This can result in longer wait times for patients and a decline in the quality of care. One key ethical principle in healthcare is justice, which calls for fair distribution of resources. When healthcare workers migrate, it creates a shortage in their home countries. This shortage means that vulnerable populations face increased health risks, including higher rates of illness and death. The lack of access to quality care deepens the existing disparities between wealthier and poorer nations. Another important principle is beneficence, which means doing good for patients. Healthcare workers have a duty to provide beneficial care. However, when many professionals leave, the remaining staff can become overwhelmed. This can lead to inadequate treatment and increased harm to patients. The ethical obligation to do good becomes difficult to fulfill in such circumstances. Respect for autonomy is also a critical factor. Healthcare workers have the right to choose where they work. Many seek better opportunities, safety, and professional growth in high-income countries. However, this individual choice can conflict with the collective need for healthcare equity in their home countries. This creates an ethical tension between personal rights and social responsibilities. Additionally, the migration of healthcare workers raises questions about duty to care. Many professionals feel a responsibility to serve their communities. When they leave, it can be seen as a breach of this duty, especially when it exacerbates health inequities. Yet, the reasons for migration often include poor working conditions, low pay, and lack of career advancement in their home countries. The factors driving brain drain include push factors, such as inadequate infrastructure and political instability, and pull factors, like higher salaries and better working conditions abroad. Addressing this issue ethically requires systemic changes in low and middle-income countries. Improving healthcare environments and policies can help retain skilled workers. Finally, global solidarity is essential. High-income countries benefit from the expertise of healthcare workers trained in low and middle-income countries. However, they often do not provide adequate support to these source countries. This raises ethical concerns about global justice and the responsibility of wealthier nations to help strengthen health systems rather than deplete them. In practical terms, solutions may include international agreements to regulate recruitment of healthcare workers, investing in local workforce development, and improving working conditions in low and middle-income countries. By addressing these issues, we can work towards reducing global health disparities caused by medical brain drain.